Question 1. The efficiency study reveals that the turnaround time for processing diagnostic imaging requests has increased by 15% over the past quarter, potentially impacting patient wait times and physician access to critical information. The department's senior radiographer believes the current workflow is optimal and that the increase is due to external factors beyond their control, such as increased patient volume and administrative delays in other departments. What is the most appropriate next step for the quality improvement team to take? Option A. Implement a new, more complex scheduling software system immediately to address the perceived inefficiencies, without further consultation with the staff. Option B. Focus solely on optimizing the technical parameters of the imaging equipment to reduce scan times, assuming this will indirectly improve overall turnaround time. Option C. Inform the department head that the study's findings are likely inaccurate due to external variables, and recommend no immediate changes to the current workflow. Option D. Conduct a detailed workflow analysis involving the radiographers and administrative staff to identify specific bottlenecks and collaboratively develop targeted solutions. The correct answer is D. Conduct a detailed workflow analysis involving the radiographers and administrative staff to identify specific bottlenecks and collaboratively develop targeted solutions. Explanation: scenario analysis. This scenario presents a common challenge in healthcare setting where a continuous quality improvement (CQI) initiative aimed at enhancing patient care and operational efficiency encounters resistance. The challenge lies in balancing the need for evidence-based improvements with the practical realities of staff workload, established routines, and potential apprehension towards change. Professionals must navigate these human factors while adhering to the principles of CQI and the ethical obligations to provide the highest standard of care, as implicitly guided by the Japanese Association of Radiological Technologists' commitment to professional excellence. Correct approach analysis. The correct approach involves a systematic, collaborative, and data-driven strategy for implementing CQI. This aligns with the core tenets of CQI, which emphasize ongoing evaluation and refinement of processes. Specifically, it involves engaging the affected staff in understanding the study's findings, collaboratively developing solutions, and implementing changes in a phased, monitored manner. This approach fosters buy-in, leverages the expertise of those directly involved in patient care, and ensures that improvements are sustainable and effective. It reflects a commitment to professional responsibility by actively seeking to optimize diagnostic imaging services for patient benefit. In line with the spirit of continuous professional development and quality assurance expected of members of the Japanese Association of Radiological Technologists. Incorrect approaches analysis. One incorrect approach involves dismissing the study's findings due to perceived inconvenience or a belief that current practices are adequate. This fails to acknowledge the fundamental principle of CQI, which is to proactively identify and address areas for improvement, even if current outcomes appear satisfactory. It represents a failure to uphold professional responsibility by potentially overlooking opportunities to enhance patient safety and diagnostic accuracy. This approach can also lead to stagnation and a decline in service quality over time, contrary to the proactive stance expected of professionals. Another incorrect approach is to implement changes unilaterally without consulting or involving the affected staff. This disregards the practical knowledge and experience of the frontline professionals, who are best positioned to identify potential implementation challenges and offer practical solutions. Such an approach can breed resentment, lead to poorly executed changes, and ultimately undermine the CQI initiative. Ethically, it fails to respect the professional autonomy and contributions of the staff, and it is unlikely to achieve the desired long-term quality improvements. A third incorrect approach is to focus solely on the technical aspects of the study without addressing the human element of change. While technical data is crucial, CQI initiatives are also about people, processes, and culture. Ignoring the need for communication, training, and support for staff can lead to resistance and failure. This approach neglects the holistic nature of quality improvement, which requires addressing all facets of the service delivery system. Professional reasoning. Professionals faced with such a scenario should adopt a structured problem-solving process. First, thoroughly understand the study's findings and their implications for patient care and operational efficiency. Second, communicate these findings transparently to the relevant staff, fostering an open dialogue about the observed issues. Third, collaborate with the staff to brainstorm potential solutions, drawing on their expertise and experience. Fourth, develop a phased implementation plan, including clear objectives, timelines, and metrics for success. Fifth, provide adequate training and support to staff during the implementation phase. Finally, continuously monitor the impact of the changes, gather feedback, and make further adjustments as needed, embodying the iterative nature of CQI. This systematic and inclusive approach ensures that improvements are evidence-based, practical, and sustainable, ultimately benefiting patients and the profession. Question 2. The monitoring system demonstrates a consistent trend of increased noise levels in axial CT images acquired using a specific detector configuration, despite maintaining nominal kVp and m as settings. Considering the principles of CT technology and the regulatory framework of the Japanese Association of Radiological Technologists, which of the following actions best addresses this observation to ensure optimal diagnostic quality and patient safety? Option A. Investigating the detector's energy response characteristics and considering recalibration or replacement if performance degradation is identified, while ensuring dose remains optimized. Option B. Adjusting the detector element pitch to a narrower value to improve spatial resolution and potentially reduce the impact of noise. Option C. Implementing a more aggressive iterative reconstruction algorithm without evaluating the underlying cause of the noise increase. Option D. Increasing the m as value to directly compensate for the observed noise, prioritizing image clarity over potential dose escalation. Correct answer is B. Adjusting the detector element pitch to a narrower value to improve spatial resolution and potentially reduce the impact of noise. Explanation. The monitoring system demonstrates a need for careful judgment due to the inherent complexities of CT principles and technology, particularly concerning image quality and patient safety. Professionals must balance the diagnostic efficacy of CT scans with the imperative to minimize radiation exposure, a core tenet of radiological practice governed by Japanese regulations and guidelines. The challenge lies in interpreting subtle variations in image acquisition parameters and their impact on diagnostic information versus potential harm. The correct approach represents best professional practice because it prioritizes a comprehensive understanding of CT physics and detector technology to optimize image acquisition protocols. This aligns with the Japanese Association of Radiological Technologists' emphasis on evidence-based practice and continuous professional development, ensuring that practitioners are equipped to make informed decisions that enhance diagnostic accuracy while adhering to radiation protection principles. Specifically, understanding how different detector materials and reconstruction algorithms affect signal-to-noise ratio and spatial resolution allows for protocol adjustments that achieve diagnostic goals with the lowest possible dose, a direct reflection of regulatory requirements for dose optimization. An incorrect approach that focuses solely on achieving the highest possible spatial resolution without considering the associated radiation dose would be professionally unacceptable. This failure would contravene the principle of ALARA, as low as reasonably achievable, as mandated by Japanese radiation safety laws and guidelines, potentially leading to unnecessary patient exposure without a commensurate increase in diagnostic benefit. Another incorrect approach, such as relying on default scanner settings without critical evaluation, neglects the professional responsibility to tailor protocols to individual patient needs and specific diagnostic questions, thereby failing to uphold the standards of care expected by the Japanese Association of Radiological Technologists. The professional decision-making process for similar situations should involve a systematic evaluation of the diagnostic task, patient factors, and available CT technology. This includes consulting relevant imaging protocols, understanding the trade-offs between image quality parameters and radiation dose, and critically assessing the output of the monitoring system in the context of established best practices and regulatory mandates. Continuous learning and engagement with advancements in CT technology are crucial for maintaining competence and ensuring patient safety. Question 3. System analysis indicates a significant shift in diagnostic imaging modalities within Japanese healthcare facilities, moving from traditional film screen systems to advanced digital imaging technologies. Considering the Japanese Association of Radiological Technologists, JART, emphasis on maintaining high standards of practice and ensuring diagnostic accuracy. What is the most appropriate professional development strategy for a radiological technologist to effectively adapt to and excel in this evolving environment? Option A. Focus primarily on increasing the speed of image acquisition with digital systems to improve patient throughput, assuming image quality will be inherently superior. Option B. Limit learning to the basic operation of digital equipment and defer in-depth understanding of image processing parameters until issues arise. Option C. Actively participate in continuing education programs and workshops focused on digital imaging principles, quality control, and system operation, as recommended by JART guidelines. Option D. Rely on existing knowledge of film screen radiography and assume that digital imaging techniques are largely transferable without specialized training. The correct answer is C. Actively participate in continuing education programs and workshops focused on digital imaging principles, quality control, and system operation, as recommended by JART guidelines. Explanation: scenario analysis. This scenario presents a professional challenge for a radiological technologist in Japan, requiring them to balance the transition from established film screen systems to newer digital imaging technologies, while adhering to the standards set by the Japanese Association of Radiological Technologists, JART. The challenge lies in ensuring that the adoption of digital imaging does not compromise diagnostic image quality or patient safety, and that the technologist's knowledge and skills remain current and compliant with evolving professional guidelines. The need for continuous learning and adaptation is paramount in this rapidly changing field. Correct approach analysis. The correct approach involves actively seeking out and participating in continuing education programs and workshops specifically focused on digital imaging technologies, as recommended by JART guidelines. This proactive engagement ensures that the technologist gains a thorough understanding of the principles, operation, and quality control measures associated with digital imaging systems, e.g., CR/DR. It directly addresses the JART emphasis on maintaining high standards of practice and competence in diagnostic imaging. By staying updated, the technologist can effectively troubleshoot, optimize image acquisition parameters, and ensure accurate image interpretation, thereby upholding diagnostic integrity and patient care as per Japanese professional standards. Incorrect approach is analysis. One incorrect approach is to rely solely on the knowledge gained during initial training for film screen systems and assume that digital imaging operates on fundamentally similar principles without further specialized learning. This fails to acknowledge the distinct technical aspects of digital detectors, image processing algorithms, and picture archiving and communication systems, PACS. Such an approach risks suboptimal image quality, potential misinterpretation, and non-compliance with JART expectations for up-to-date expertise. Another incorrect approach is to prioritize speed of image acquisition over image quality and diagnostic adequacy when using digital systems. Digital imaging can offer faster workflows. An uncritical focus on speed without proper technique and quality control can lead to the acquisition of images that are technically deficient, potentially requiring repeat exposures or leading to diagnostic errors. This disregards the JART core principle of ensuring diagnostic efficacy. A third incorrect approach is to neglect the importance of understanding the digital image processing parameters and their impact on image appearance and diagnostic information. Digital systems offer extensive post-processing capabilities, but a lack of understanding can lead to inappropriate adjustments that either obscure subtle pathology or create artifacts, compromising the diagnostic value of the image. This directly contravenes the JART commitment to accurate diagnostic imaging. Professional reasoning. Professionals in this field should adopt a mindset of continuous professional development. When faced with technological advancements like the shift to digital imaging, the decision-making process should involve 1. Identifying the specific knowledge and skill gaps created by the new technology. 2. Consulting relevant professional body guidelines, in this case JART, for recommended practices and training. 3. Actively seeking out and engaging in accredited educational opportunities. 4. Applying newly acquired knowledge systematically, with a focus on maintaining diagnostic image quality and patient safety. 5. Regularly evaluating one's practice against established standards and seeking feedback. This structured approach ensures that professional practice remains compliant, effective, and aligned with the evolving landscape of radiological technology in Japan. Question 4. Assessment of the fundamental interactions of X-ray photons with matter in diagnostic radiology, considering their impact on image contrast and patient dose, requires a nuanced understanding. Which of the following explanations best characterizes these interactions within the typical energy range of diagnostic X-ray beams? Option A. Photoelectric absorption is the primary contributor to image contrast by preferentially attenuating low-energy photons in dense tissues, while Compton scattering is the dominant interaction at higher energies, producing scatter radiation that degrades image quality and increases patient dose. Option B. Pair production is the most significant interaction in diagnostic radiology, leading to the creation of electron-positron pairs that are responsible for image formation and dose deposition. Option C. Rayleigh scattering is the predominant interaction, where photons are deflected without energy loss, contributing significantly to image noise and requiring higher exposure factors to overcome. Option D. Compton scattering is the sole interaction responsible for image formation, where scattered photons are detected and contribute to the diagnostic signal, while photoelectric absorption is negligible in diagnostic imaging. The correct answer is A. Photoelectric absorption is the primary contributor to image contrast by preferentially attenuating low-energy photons in dense tissues, while Compton scattering is the dominant interaction at higher energies, producing scatter radiation that degrades image quality and increases patient dose. Explanation: the scenario presents a common challenge in diagnostic radiology, understanding how different radiation interactions with matter affect image quality and patient dose, and then applying this knowledge to optimize imaging protocols. Professionals must discern the most accurate and relevant explanation of these interactions in the context of diagnostic imaging, adhering to the principles of radiation protection and diagnostic efficacy, as mandated by the Japanese Association of Radiological Technologists guidelines and relevant Japanese laws concerning medical radiation use. The correct approach accurately describes the dominant interaction mechanisms in diagnostic X-ray energies and their consequences. It emphasizes photoelectric absorption and Compton scattering, explaining how photoelectric absorption contributes to contrast by preferentially absorbing low-energy photons in high-density tissues, while Compton scattering contributes to scatter radiation, reducing image contrast and increasing patient dose. This understanding is crucial for selecting appropriate KVP and M as settings, filtration, and collimation to achieve diagnostic quality images with minimal radiation exposure, aligning with the ALARA principle and the ethical duty of care. An incorrect approach might overemphasize less relevant interactions for diagnostic X-ray energies, such as pair production, which is significant only at much higher energies. Alternatively, an incorrect approach might fail to differentiate the roles of photoelectric absorption and Compton scattering in image formation and dose, leading to a superficial understanding that cannot inform practical protocol optimization. Another incorrect approach might focus solely on one interaction without considering its interplay with others or its impact on both image quality and patient safety, thus failing to meet the comprehensive requirements for professional practice. Professional reasoning in such situations involves a systematic evaluation of the physical principles of radiation interaction in the context of diagnostic imaging. It requires recalling and applying knowledge of the energy dependence of these interactions, their relative probabilities in different materials, like bone and soft tissue, and their impact on the detected signal and scattered radiation. This knowledge must then be translated into practical decisions regarding imaging parameters and techniques, always prioritizing patient well-being and diagnostic accuracy, in accordance with the standards set by the Japanese Association of Radiological Technologists. Question 5. Comparative studies suggest that different image reconstruction algorithms can significantly alter the appearance of anatomical structures and the detection of subtle pathologies. A radiological technologist is tasked with selecting an algorithm for a new CT acquisition. While one algorithm produces subjectively sharper images, another is known to reduce image noise but may introduce minor geometric distortions. A senior colleague suggests using the sharper algorithm, stating it always looks better, considering the ethical and professional responsibilities governed by the Japanese Association of Radiological Technologists, which approach best upholds professional practice. Option A. Choose the algorithm that has been used historically within the department, assuming it is adequate for most diagnostic purposes. Option B. Select the algorithm that produces subjectively sharper images, as recommended by the senior colleague, prioritizing visual clarity. Option C. Select the algorithm that is known to reduce image noise, even if it introduces minor geometric distortions, to improve overall image quality and potential for detecting subtle findings. Option D. Critically evaluate the characteristics of both algorithms, considering their impact on diagnostic accuracy, potential for artifacts, and radiation dose implications, and consult relevant literature and protocols before making a decision. The correct answer is B. Select the algorithm that produces subjectively sharper images, as recommended by the senior colleague, prioritizing visual clarity. Explanation. This scenario presents a professional challenge because it requires a radiological technologist to balance the pursuit of diagnostic image quality with the ethical imperative of patient safety and the responsible use of resources, all within the framework of the Japanese Association of Radiological Technologists guidelines. The technologist must critically evaluate the implications of different image reconstruction algorithms beyond their immediate visual impact, considering potential subtle artifacts, radiation dose implications, and the overall diagnostic utility of the resulting images. The correct approach represents best professional practice because it prioritizes a comprehensive understanding of the chosen algorithm's characteristics and its impact on diagnostic accuracy and patient safety. This involves consulting relevant literature, understanding the algorithm's limitations, and ensuring its application aligns with established protocols and the specific clinical context. Adherence to the Japanese Association of Radiological Technologists ethical codes and technical guidelines, which emphasize professional competence and patient well-being, is paramount. This approach demonstrates a commitment to evidence-based practice and continuous professional development. An incorrect approach that focuses solely on achieving the subjectively clearest image without considering the underlying algorithm's properties or potential artifacts would be professionally unacceptable. This could lead to misinterpretation of subtle findings or the creation of images that appear sharp but contain misleading information, violating the principle of providing accurate diagnostic data. Furthermore, selecting an algorithm without understanding its radiation dose implications or its suitability for the specific imaging modality and clinical question could lead to unnecessary radiation exposure for the patient, a direct contravention of radiation protection principles. Another incorrect approach might involve blindly following a colleague's recommendation without independent verification or critical assessment, which fails to uphold the technologist's responsibility for their own professional judgment and the quality of the images they produce. This also neglects the importance of understanding the specific nuances of different reconstruction techniques as outlined by professional bodies. The professional decision-making process for similar situations should involve a systematic evaluation. First, understanding the clinical indication and the required diagnostic information. Second, researching and understanding the characteristics, advantages, and limitations of available image reconstruction algorithms. Third, considering the potential impact on image quality, diagnostic accuracy, and patient radiation dose. And fourth, selecting the algorithm that best balances these factors, in consultation with radiologists and adhering to institutional protocols and professional guidelines. Question 6. The performance metrics show a consistent, albeit slight, increase in signal-to-noise ratio (SNR) across all routine imaging sequences over the past month, with no apparent degradation in image quality to the naked eye. What is the most appropriate initial risk assessment and response according to the Japanese Association of Radiological Technologists framework for MRI equipment management? Option A. Focus on subjective visual assessment of the latest patient images to confirm the perceived lack of image degradation, disregarding the quantitative SNR trend. Option B. Initiate a detailed diagnostic scan of the MRI system's gradient linearity and magnetic field homogeneity, and consult the equipment manufacturer's service manual for troubleshooting steps related to SNR fluctuations. Option C. Immediately schedule a full system shutdown and request an emergency service call from the equipment manufacturer to address the potential equipment malfunction. Option D. Conclude that the increased SNR is a beneficial improvement in image quality and continue with routine patient scanning without further investigation. The correct answer is B. Initiate a detailed diagnostic scan of the MRI system's gradient linearity and magnetic field homogeneity, and consult the equipment manufacturer's service manual for troubleshooting steps related to SNR fluctuations. Explanation: Scenario analysis. This scenario presents a professional challenge because it requires a radiological technologist to interpret performance metrics of an MRI scanner in the context of patient safety and diagnostic image quality, adhering strictly to the standards set by the Japanese Association of Radiological Technologists, JAR. The challenge lies in identifying subtle deviations that might indicate a risk to patient well-being or compromise the diagnostic utility of the images, necessitating a proactive and informed response. Correct approach analysis. The correct approach involves recognizing that a consistent increase in signal-to-noise ratio, SNR, across multiple sequences, even if seemingly positive, could indicate an underlying issue with gradient linearity or magnetic field homogeneity. According to JART guidelines and best practices in diagnostic imaging, maintaining optimal image quality and ensuring the safe operation of MRI equipment are paramount. A deviation from established baseline performance, even if not immediately catastrophic, warrants investigation to prevent potential misdiagnosis or equipment malfunction. This proactive stance aligns with the ethical responsibility to provide high-quality patient care and uphold professional standards. Incorrect approaches analysis. One incorrect approach is to dismiss the observed increase in SNR as a positive improvement without further investigation. This fails to acknowledge that performance metrics can indicate subtle equipment drift or degradation that, if left unaddressed, could lead to more significant issues affecting image quality and potentially patient safety. This approach neglects the JART emphasis on continuous quality assurance and equipment monitoring. Another incorrect approach is to immediately assume a major equipment failure and halt all scanning. While safety is critical, an overreaction without proper diagnostic steps can lead to unnecessary downtime and patient inconvenience. This approach bypasses the systematic troubleshooting and risk assessment expected of a professional, potentially violating operational efficiency guidelines. A third incorrect approach is to focus solely on the aesthetic appearance of the images without correlating it to the underlying performance metrics. Diagnostic imaging relies on objective data and consistent performance. Ignoring quantifiable metrics in favor of subjective visual assessment can lead to overlooking critical technical issues that impact diagnostic accuracy, a direct contravention of professional imaging standards. Professional reasoning. Professionals should adopt a systematic approach to performance metric analysis. This involves establishing baseline performance, regularly monitoring key indicators, and investigating any significant deviations. When anomalies are detected, the decision-making process should involve 1. Understanding the potential implications of the deviation on image quality and patient safety. 2. Consulting relevant JART guidelines and equipment manuals. 3. Performing targeted troubleshooting steps. And 4. Escalating the issue to appropriate technical personnel if necessary. This structured approach ensures that decisions are evidence-based, compliant with regulations, and prioritize patient well-being and diagnostic integrity. Question 7. To address the challenge of minimizing patient radiation dose during a complex interventional fluoroscopy procedure, what is the most appropriate and regulatory compliant approach for a radiological technologist in Japan? Option A. Focus primarily on achieving optimal image quality, assuming that dose management is solely the responsibility of the radiologist. Option B. Rely exclusively on the radiologist's verbal instructions regarding the duration of fluoroscopic exposure without independent dose tracking. Option C. Consider the cumulative dose display as a secondary indicator and prioritize procedural speed over strict collimation. Option D. Continuously monitor the cumulative dose displayed on the fluoroscopy unit and utilize effective collimation to restrict the irradiated field to the area of clinical interest. The correct answer is D. Continuously monitor the cumulative dose displayed on the fluoroscopy unit and utilize effective collimation to restrict the irradiated field to the area of clinical interest. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent risks associated with fluoroscopic procedures, specifically the potential for radiation-induced skin injuries in patients. The technologist must balance the diagnostic necessity of the procedure with the imperative to minimize radiation dose, adhering to the principles of ALARA, as low as reasonably achievable, as mandated by Japanese regulations governing medical radiation use. The complexity arises from the dynamic nature of fluoroscopy, where real-time adjustments are often required, necessitating constant vigilance regarding exposure parameters and patient positioning. Correct approach analysis. The correct approach emphasizes continuous monitoring of cumulative dose displayed on the fluoroscopy unit and judicious use of collimation. This aligns directly with the principles outlined in the Act on Prevention of Radiation Hazards Due to Radioisotopes, etc. Chinese letter, 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 Japanese letter, Chinese letter, Chinese letter, Japanese letter, Chinese letter, Japanese letter, Japanese letter, Chinese letter, Chinese letter, and related guidelines from the Japanese Association of Radiological Technologists. Real-time dose monitoring allows for immediate intervention if exposure levels approach predetermined safety thresholds. Effective collimation significantly reduces the irradiated field, thereby minimizing scatter radiation to both the patient and staff, and reducing overall patient dose. This proactive approach demonstrates adherence to the fundamental duty of care and radiation protection standards. Incorrect approaches analysis. One incorrect approach involves relying solely on the radiologist's verbal cues for exposure duration without independent dose monitoring. This fails to acknowledge the technologist's direct responsibility for radiation safety and dose management during the procedure, potentially leading to cumulative overexposure if the radiologist's estimations are inaccurate or if unforeseen circumstances extend the exposure time. This contravenes the principle of individual responsibility for radiation protection. Another incorrect approach is to disregard the cumulative dose display, assuming it is merely informational and not critical for active management. This demonstrates a lack of understanding of the regulatory emphasis on dose tracking and management, which is crucial for preventing deterministic effects like skin burns. It represents a failure to actively implement ALARA principles. A further incorrect approach is to neglect proper collimation, citing convenience or time constraints. This directly violates established radiation protection protocols that mandate the smallest practical field size. The failure to collimate effectively increases patient dose and scatter radiation, posing an unnecessary risk and contravening the spirit and letter of radiation safety regulations. Professional reasoning. Professionals should adopt a systematic approach that integrates real-time monitoring, active dose management, and adherence to established radiation protection protocols. This involves understanding the specific requirements of each fluoroscopic examination, anticipating potential challenges, and proactively implementing measures to minimize radiation exposure while ensuring diagnostic image quality. Regular review of institutional protocols and ongoing professional development in radiation safety are essential for maintaining best practices. Question 8. Benchmark analysis indicates that variations in imaging sequence selection and parameter optimization significantly impact diagnostic accuracy for suspected intracranial lesions. A radiologic technologist is tasked with acquiring MRI images of a patient presenting with symptoms suggestive of a small, hyperacute ischemic stroke. Which of the following approaches best balances the need for rapid acquisition, artifact reduction, and optimal visualization of subtle ischemic changes within the Japanese Association of Radiological Technologists framework for diagnostic imaging? Option A. Prioritizing diffusion-weighted imaging, DWI, with a high B-value and a reduced field of view, alongside T2-weighted imaging with a fast spin echo sequence and minimal parameter adjustments from the standard protocol. Option B. Utilizing a rapid T2-weighted sequence with a reduced matrix size and a standard B-value DWI sequence, focusing primarily on minimizing scan time to improve patient comfort. Option C. Selecting a T1-weighted sequence with fat suppression, a T2-weighted sequence with a long TE, and a standard DWI sequence with a moderate B-value, without considering the specific hyperacute phase of ischemia. Option D. Employing a standard T1-weighted sequence with a long acquisition time to maximize signal-to-noise ratio, followed by a T2-weighted sequence with a large field of view and standard parameters, without specific consideration for acute stroke. The correct answer is A. Prioritizing diffusion-weighted imaging, DWI, with a high B-value and a reduced field of view, alongside T2-weighted imaging with a fast spin echo sequence and minimal parameter adjustments from the standard protocol. Explanation: scenario analysis. This scenario presents a common implementation challenge in diagnostic imaging, optimizing imaging sequences and parameters for a specific patient condition while adhering to established protocols and ensuring diagnostic quality. The challenge lies in balancing the need for detailed anatomical visualization with the potential for motion artifacts, patient comfort, and radiation dose considerations. Radiologic technologists must possess a deep understanding of how different pulse sequences and parameter adjustments influence image contrast, signal-to-noise ratio, and acquisition time, all within the framework of the Japanese Association of Radiological Technologists guidelines and the specific clinical indication. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's condition and the diagnostic question, followed by the selection and optimization of imaging sequences and parameters that best address these factors. This includes considering the inherent properties of different pulse sequences, e.g., T1-weighted, T2-weighted, flare, diffusion-weighted imaging, and their sensitivity to specific tissue characteristics and pathologies. Parameter adjustments such as echo time T, repetition time TR, flip angle, and matrix size are then fine-tuned to enhance contrast, reduce artifacts, and achieve an acceptable scan time. This approach aligns with the professional responsibility of radiologic technologists to deliver high-quality diagnostic images, minimize patient discomfort and radiation exposure, and comply with the standards set by the Japanese Association of Radiological Technologists, which emphasize evidence-based practice and patient safety. Incorrect approaches analysis. One incorrect approach is to rigidly adhere to a standard protocol without considering patient-specific factors or the nuances of the pathology. This can lead to suboptimal image quality, misdiagnoses, or the need for repeat scans, increasing patient burden and resource utilization. This failure to adapt to individual needs may contravene the ethical imperative to provide the best possible care. Another incorrect approach is to arbitrarily alter parameters without a clear understanding of their impact. This can result in severe image artifacts, such as ghosting or signal loss, rendering the images diagnostically useless. Such an approach demonstrates a lack of fundamental knowledge and a disregard for the principles of image acquisition, potentially violating professional standards of competence. A third incorrect approach is to prioritize scan speed over diagnostic quality by using excessively short acquisition times or simplified sequences. While efficiency is important, it should not compromise the ability to accurately diagnose the condition. This could lead to misdiagnosis and harm to the patient, representing a significant ethical and professional failing. Professional reasoning. Professionals facing this challenge should employ a decision-making process that begins with a thorough review of the clinical request and patient history. They should then consult relevant imaging protocols and guidelines from the Japanese Association of Radiological Technologists, considering the specific diagnostic objectives. Based on this information, they should select appropriate pulse sequences and then judiciously adjust parameters to optimize image quality for the specific pathology and patient. This iterative process of selection, adjustment, and evaluation, informed by theoretical knowledge and practical experience, is crucial for achieving diagnostic excellence and upholding professional standards. Question 9. Stakeholder feedback indicates a need for enhanced training on the ethical application of ultrasound imaging in educational settings. A radiologic technologist has captured several high-quality ultrasound images demonstrating a rare anatomical variation during a patient examination. The technologist believes these images would be invaluable for teaching junior colleagues and students about this variation. However, the patient's identity is not explicitly visible in the images, and the patient's medical record does not contain specific consent for educational use of their imaging data. What is the most ethically and legally sound approach for the technologist to take regarding the use of these images for educational purposes? Option A. Assume that consent for general medical treatment implicitly covers the use of imaging data for educational purposes. Option B. Proceed with using the anonymized images for educational purposes, as the patient's identity is not directly visible and the educational benefit is significant. Option C. Seek approval from a senior radiologist to use the images, relying on their professional judgment to determine if consent is required. Option D. Obtain explicit, informed consent from the patient for the use of their images in educational materials, ensuring they understand the purpose and have the right to refuse. The correct answer is D. Obtain explicit, informed consent from the patient for the use of their images in educational materials, ensuring they understand the purpose and have the right to refuse. Explanation. Scenario analysis. This scenario presents a professional challenge rooted in the ethical obligation to maintain patient confidentiality versus the potential benefit of sharing information for educational purposes. The radiologic technologist must navigate the delicate balance between respecting patient privacy, as mandated by Japanese regulations concerning medical information, and contributing to the advancement of ultrasound technology through case study dissemination. The challenge lies in obtaining informed consent without compromising the patient's trust or violating legal and ethical standards. Correct approach analysis. The correct approach prioritizes obtaining explicit, informed consent from the patient before using any identifiable information or images for educational purposes. This aligns with the fundamental ethical principles of patient autonomy and confidentiality, which are implicitly and explicitly supported by Japanese medical ethics and professional guidelines for radiological technologists. Process must ensure the patient fully understands how their information will be used, the potential risks and benefits, and has the right to refuse without prejudice to their care. Anonymization of data is a crucial step, but even anonymized images can sometimes be re-identifiable, making explicit consent paramount. Incorrect approach is analysis. One incorrect approach involves using patient images for educational purposes without seeking any consent, even if the images are anonymized. This violates the principle of patient autonomy and the expectation of privacy regarding medical records. While anonymization reduces the risk of direct identification, it does not negate the ethical obligation to obtain consent for the use of personal health information, even in a de-identified form, for purposes beyond direct patient care. Japanese regulations emphasize the protection of personal information, and this approach would likely contravene those principles. Another incorrect approach is to assume that consent for general medical treatment implicitly includes consent for educational use of images. Medical consent is typically specific to the treatment being provided. Using images for educational purposes constitutes a secondary use of that information and requires a separate, informed consent process. Failing to obtain this specific consent breaches the trust between the patient and the healthcare provider and disregards the patient's right to control their personal health data. A further incorrect approach is to rely solely on the discretion of a supervisor or senior colleague to determine if consent is necessary. While professional guidance is important, the ultimate responsibility for ethical conduct and adherence to regulations rests with the individual technologist. Decisions regarding patient confidentiality and the use of medical information must be based on established ethical principles and legal frameworks, not solely on the judgment of others, especially when patient rights are involved. Professional reasoning. Professionals facing such dilemmas should follow a structured decision-making process. First, identify the ethical and legal obligations relevant to the situation, specifically focusing on patient confidentiality and informed consent within the Japanese regulatory framework. Second, assess the potential impact of each possible action on the patient, the profession, and the institution. Third, consult relevant professional guidelines and, if necessary, seek advice from ethics committees or legal counsel. Fourth, prioritize actions that uphold patient autonomy and confidentiality while also considering legitimate professional development needs. In this case, the process must lead to obtaining explicit, informed consent, ensuring full transparency with the patient. Question 10. Cost-benefit analysis shows that a new, advanced imaging modality offers a potential for earlier and more precise diagnosis of certain conditions, but its initial acquisition cost is significantly higher than existing equipment, and its long-term operational expenses are projected to be substantial. Considering the principles of responsible radiological practice and patient care, as advocated by the Japanese Association of Radiological Technologists, which of the following represents the most appropriate next step in evaluating this modality? Option A. Conduct a comprehensive review of peer-reviewed literature and clinical trials to assess the modality's proven diagnostic efficacy, patient outcomes, and potential for dose reduction, alongside an evaluation of its integration into existing clinical workflows and the necessary staff training requirements. Option B. Proceed with the acquisition of the new modality immediately, given its advanced capabilities, to ensure the institution remains at the forefront of diagnostic imaging technology. Option C. Defer the decision indefinitely due to the high initial cost, focusing resources on maintaining and upgrading current equipment to maximize its lifespan. Option D. Rely solely on the manufacturer's promotional materials and sales demonstration to gauge the modality's benefits and justify its purchase. The correct answer is A. Conduct a comprehensive review of peer-reviewed literature and clinical trials to assess the modality's proven diagnostic efficacy, patient outcomes, and potential for dose reduction, alongside an evaluation of its integration into existing clinical workflows and the necessary staff training requirements. Explanation. Scenario analysis. This scenario presents a common challenge in radiological physics, balancing the acquisition of advanced technology with the practical constraints of resource allocation and patient care. The introduction of a new imaging modality, while potentially offering diagnostic advantages, necessitates a thorough evaluation of its cost-effectiveness and impact on existing workflows and patient safety. The professional challenge lies in making an informed decision that prioritizes patient well-being and diagnostic accuracy while adhering to the principles of responsible resource management, as guided by the Japanese Association of Radiological Technologists, JART, ethical and professional standards. Correct approach analysis. The correct approach involves a comprehensive evaluation that considers not only the direct financial cost of the new equipment, but also its potential benefits in terms of improved diagnostic accuracy, reduced patient radiation dose, if applicable, enhanced workflow efficiency, and the long-term implications for staff training and maintenance. This aligns with the JART emphasis on continuous quality improvement and the ethical imperative to provide the highest standard of care. Specifically, the JART guidelines implicitly encourage the adoption of technologies that demonstrably improve patient outcomes and safety, provided they are implemented responsibly and sustainably. A thorough risk-benefit assessment, including a review of relevant scientific literature and consultation with clinical stakeholders, is paramount. Incorrect approaches analysis. One incorrect approach is to prioritize the acquisition of the newest technology solely based on its perceived prestige or the marketing claims of the manufacturer, without a rigorous assessment of its actual clinical utility or cost-effectiveness. This could lead to inefficient resource allocation, potentially diverting funds from essential services or other areas that could yield greater patient benefit. Such an approach would contravene the JART principles of responsible practice and could be seen as a failure to act in the best interest of patients and the institution. Another incorrect approach is to dismiss the new modality outright due to initial cost concerns without exploring potential cost-saving measures or alternative implementation strategies. This might mean foregoing a technology that could ultimately lead to better diagnosis, reduced need for more invasive procedures, or improved patient outcomes, thereby failing to uphold the JART commitment to advancing radiological practice. A third incorrect approach is to implement the new technology without adequate staff training or quality assurance protocols. This poses a significant risk to patient safety and diagnostic integrity, as improper use or interpretation of images can lead to misdiagnosis or unnecessary radiation exposure. This directly violates the JART emphasis on professional competence and the safe operation of radiological equipment. Professional reasoning. Radiological technologists, in collaboration with physicists and other healthcare professionals, must adopt a systematic decision-making process. This involves 1. Clearly defining the clinical need or problem the new technology aims to address. 2. Conducting a thorough literature review to understand the evidence supporting the technology's efficacy and safety. 3. Performing a comprehensive cost-benefit analysis that includes direct and indirect costs, as well as potential benefits to patients and the institution. 4. Consulting with relevant stakeholders, including clinicians, other technologists, and administrators. 5. Developing a robust implementation plan that includes training, quality control, and ongoing evaluation. And 6. Continuously monitoring the technology's performance and impact after implementation. This structured approach ensures that decisions are evidence-based, ethically sound, and aligned with the JART professional standards. Question 11. Consider a scenario where a radiologic technologist receives a referral for an abdominal ultrasound on a patient with a known history of deep vein thrombosis, DVT, and a general complaint of abdominal discomfort. The standard protocol for abdominal ultrasound does not typically include specific vascular assessments of the lower extremities. What is the most appropriate course of action for the technologist to ensure optimal patient care and diagnostic accuracy within the framework of Japanese Association of Radiological Technologists guidelines? Option A. Perform a comprehensive abdominal ultrasound, including a focused assessment of the inferior vena cava and iliac veins, and consult with the supervising radiologist regarding the relevance of the patient's DVT history to the abdominal findings. Option B. Inform the patient that their DVT history is unrelated to the abdominal ultrasound and proceed with the standard protocol without further consultation. Option C. Proceed with the standard abdominal ultrasound protocol, focusing solely on the abdominal organs as requested, and document the patient's DVT history in the report. Option D. Immediately cancel the abdominal ultrasound and refer the patient for a vascular ultrasound of the lower extremities, as the DVT history is paramount. The correct answer is C. Proceed with the standard abdominal ultrasound protocol, focusing solely on the abdominal organs as requested, and document the patient's DVT history in the report. Explanation. Scenario analysis. This scenario presents a common challenge in diagnostic imaging where a radiologic technologist encounters a patient with a complex medical history and a request for an ultrasound examination that may require adaptation beyond standard protocols. The challenge lies in balancing the need for accurate diagnostic imaging with patient safety, ethical considerations, and adherence to established professional standards and guidelines set by the Japanese Association of Radiological Technologists, JART. The technologist must exercise sound professional judgment to ensure the examination is both clinically effective and ethically sound, considering the patient's specific condition and the potential for unexpected findings. Correct approach analysis. The correct approach involves a thorough pre-examination assessment, including reviewing the patient's medical history and the referring physician's request, followed by a clear and empathetic communication with the patient to explain the procedure and address any concerns. Crucially, it requires the technologist to consult with the supervising radiologist or physician regarding any ambiguities or potential modifications to the standard protocol, especially when dealing with a patient with a history of deep vein thrombosis and a request for abdominal ultrasound. This collaborative approach ensures that the examination is tailored to the patient's specific needs, maximizes diagnostic yield, and adheres to the principles of patient care and professional responsibility as outlined by JART guidelines. It prioritizes patient safety and diagnostic accuracy through expert consultation and informed decision-making. Incorrect approach is analysis. Proceeding with a standard abdominal ultrasound protocol without consulting the radiologist, despite the patient's history of deep vein thrombosis and the potential for incidental findings that might be relevant to their vascular condition, represents a failure to exercise due diligence and a potential deviation from best practice. This could lead to an incomplete or suboptimal examination. Performing the ultrasound without adequately explaining the procedure or addressing the patient's potential anxieties, particularly given their medical history, is an ethical lapse in patient communication and consent, which is a cornerstone of professional practice. Ignoring the patient's history of deep vein thrombosis and focusing solely on the abdominal organs without considering potential indirect implications or the need for specific views or complementary examinations would be a failure to provide comprehensive care and could miss critical diagnostic information. Professional reasoning. Professionals in diagnostic imaging should adopt a systematic approach. 1. Thoroughly review the referral and patient history. 2. Conduct a pre-examination interview with the patient to assess their condition, understand their concerns, and obtain informed consent. 3. Evaluate the request against established protocols and the patient's specific circumstances. 4. If any aspect of the request or patient condition presents ambiguity or requires protocol modification, consult with the supervising radiologist or referring physician. 5. Perform the examination with meticulous attention to detail, ensuring patient comfort and safety. 6. Document findings accurately and communicate any significant observations to the radiologist. Question 12. The investigation demonstrates a series of linear, closely spaced echoes emanating from a surgical clip, appearing as a distinct comet tail extending away from the clip. The technologist is aware that this phenomenon is a common artifact in ultrasound imaging. Which of the following represents the most appropriate course of action for the radiological technologist? Option A. Report the comet tail artifact as a potential new pathological finding, recommending further investigation by a radiologist to determine its nature. Option B. Document the presence of the comet tail artifact, explaining its likely cause as reverberation from the surgical clip, and proceed with the examination, ensuring other diagnostic areas are clearly visualized. Option C. Ignore the comet tail artifact, as it is a known artifact and does not represent actual tissue, and continue the examination without further comment. Option D. Assume the comet tail artifact indicates a malfunction of the ultrasound transducer, and cease the examination to request equipment service. The correct answer is B. Document the presence of the comet tail artifact, explaining its likely cause as reverberation from the surgical clip, and proceed with the examination, ensuring other diagnostic areas are clearly visualized. Explanation. Scenario analysis. This scenario presents a common challenge in diagnostic ultrasound where image artifacts can mimic or obscure pathology, potentially leading to misdiagnosis. The professional challenge lies in accurately interpreting ultrasound images, distinguishing between true anatomical structures or pathological findings and artifacts, and understanding the underlying physics that cause these artifacts. This requires a strong foundation in ultrasound physics and instrumentation, as well as critical thinking skills to apply this knowledge in a clinical context. The responsibility to provide accurate diagnostic information to the referring physician, and ultimately to the patient, necessitates a thorough understanding of image quality and artifact reduction techniques. Correct approach analysis. The correct approach involves recognizing the characteristic appearance of reverberation artifacts, specifically comet tail artifacts, which are commonly seen with strongly reflective interfaces like surgical clips or calcification. Understanding that these artifacts are caused by repeated reflections between two highly reflective surfaces, and that they typically appear as a series of progressively weaker echoes along the beam path, allows the technologist to correctly identify them. The best professional practice, guided by the principles of diagnostic imaging and the ethical obligation to provide accurate information, is to identify the artifact, understand its cause, and document its presence and characteristics without misinterpreting it as pathology. This upholds the standards of practice expected by the Japanese Association of Radiological Technologists, emphasizing accurate image acquisition and interpretation. Incorrect approaches analysis. Misinterpreting the comet tail artifact as a pathological finding, such as a small cyst or a foreign body, represents a failure to apply fundamental knowledge of ultrasound physics. This would lead to an inaccurate report, potentially causing unnecessary patient anxiety, further investigations, and inappropriate treatment. This approach violates the ethical duty to provide accurate diagnostic information and the professional responsibility to maintain competence in interpreting ultrasound images. Assuming the artifact is a technical malfunction of the equipment without further investigation or understanding of common artifact types demonstrates a lack of diagnostic reasoning. While equipment issues can occur, common artifacts have predictable appearances and causes. Failing to consider the physics behind the observed phenomenon and jumping to a conclusion about equipment failure is unprofessional and can delay proper diagnosis. This neglects the technologist's role in optimizing image quality and troubleshooting based on physical principles. Ignoring the artifact altogether and proceeding with the examination as if the image is clear is a significant failure in professional responsibility. This approach overlooks potential diagnostic clues or misleading information that the artifact might present. It demonstrates a lack of diligence in image assessment and a disregard for the potential impact of artifacts on diagnostic accuracy, which is contrary to the meticulous standards required in medical imaging. Professional reasoning. Professionals facing such a situation should employ a systematic approach. First, observe the image carefully and identify any unusual patterns or echoes. Second, recall knowledge of common ultrasound artifacts and their characteristic appearances. Third, consider the anatomical location and surrounding structures to help differentiate between artifacts and true pathology. Fourth, If unsure, consult with a more experienced colleague or supervisor. Finally, document all findings accurately, including the identification and explanation of any artifacts, to ensure clear communication with the referring physician. This process ensures that diagnostic decisions are based on sound scientific principle and ethical consideration. Question 13. Upon reviewing the patient's chart and the requested examination, a radiological technologist notes that the prescribed exposure factors for an abdominal X-ray appear to be higher than typically used for a patient of similar size. The technologist understands the importance of obtaining diagnostic quality images, but is also acutely aware of the regulatory mandate to minimize radiation dose to the patient. What is the most appropriate course of action for the technologist in this situation, considering the principles of radiation dose and measurement within the Japanese regulatory framework? Option A. Proceed with the examination using the prescribed exposure factors without modification, as they were ordered by the physician. Option B. Immediately stop the examination and inform the patient that the prescribed dose is too high. Option C. Adjust the exposure factors to a lower setting that is still likely to produce a diagnostically acceptable image, while ensuring appropriate shielding is used. Option D. Significantly reduce the exposure factors to the lowest possible setting to minimize dose, even if it means a slight compromise in image detail. Correct answer is C. Adjust the exposure factors to a lower setting that is still likely to produce a diagnostically acceptable image, while ensuring appropriate shielding is used. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a radiological technologist to balance the imperative of obtaining diagnostic quality images with the ethical and regulatory obligation to minimize radiation exposure to the patient. The technologist must critically assess the situation, understand the implications of dose on image quality, and make an informed decision that prioritizes patient safety without compromising diagnostic efficacy, all within the framework of Japanese regulations. Correct approach analysis. The correct approach involves a thorough assessment of the patient's condition and the specific imaging requirements. This includes considering factors such as patient size, the anatomical region being imaged, and the clinical question being asked. The technologist must then evaluate if the current exposure parameters are appropriate for achieving the necessary diagnostic information, while adhering to the principles of ALARA, as low as reasonably achievable, as mandated by Japanese radiation protection laws and guidelines. If the initial parameters are deemed excessive or insufficient, the technologist should adjust them judiciously, perhaps by modifying KVP, M as, or filtration, or by employing appropriate shielding to optimize the dose-image quality relationship. This demonstrates a commitment to patient well-being and compliance with regulatory standards for radiation safety. Incorrect approach is analysis. One incorrect approach would be to proceed with imaging using parameters that are clearly excessive, even if they produce a technically acceptable image. This disregards the fundamental principle of minimizing radiation dose and violates the ALARA principle, potentially leading to unnecessary stochastic or deterministic effects for the patient. Such an action would be a direct contravention of the ionizing radiation medical exposure law. Chinese letter, Chinese letter, Chinese letter, Japanese letter, Chinese letter, Japanese letter, Chinese letter, Chinese letter, Chinese letter, Japanese letter, Japanese letter, Japanese letter, Chinese letter, Chinese letter, Japanese letter, Chinese letter, Japanese letter, Japanese letter, Chinese letter, Chinese letter, and associated guidelines. Another incorrect approach would be to significantly reduce the radiation dose to the point where diagnostic image quality is compromised, making it difficult or impossible for the radiologist to make an accurate diagnosis. While dose reduction is important, it must not come at the expense of diagnostic utility. This failure to achieve diagnostic quality could lead to misdiagnosis, requiring repeat examinations, and thus further radiation exposure, or leading to incorrect treatment decisions, which is also a violation of the principles of responsible medical imaging practice and patient care. A third incorrect approach would be to ignore any potential for dose reduction or optimization, simply using standard protocols without critical evaluation of their applicability to the individual patient. This demonstrates a lack of professional judgment and a failure to engage with the dynamic nature of radiation protection in clinical practice, which requires ongoing assessment and adaptation of techniques. Professional reasoning. Professionals should employ a systematic decision-making process that begins with understanding the clinical context and the specific imaging objective. This involves consulting relevant protocols, but more importantly, critically evaluating their suitability for the individual patient. They must possess a strong understanding of radiation physics, dose measurement principles, and the relationship between exposure factors and image quality. When faced with a situation where dose optimization is a concern, the technologist should consider all available tools and techniques, including adjustments to exposure factors, use of appropriate shielding, and selection of optimal imaging protocols. If there is any doubt about the appropriateness of the chosen parameters, consultation with a senior technologist or a medical physicist should be sought. This proactive and critical approach ensures that patient safety is paramount while maintaining the highest standards of diagnostic imaging. Question 14. Risk assessment procedures indicate that when imaging a patient with a larger body habitus, a radiographer must select appropriate exposure factors to achieve diagnostic image quality while adhering to radiation safety principles. Which of the following approaches best reflects best professional practice according to the Japanese Association of Radiological Technologists guidelines? Option A. Select exposure factors that are optimized for the specific patient size and the anatomical region being imaged, aiming to achieve diagnostic quality with the lowest reasonably achievable dose. Option B. Prioritize obtaining the highest possible image resolution by using the maximum allowable M and shortest possible exposure time, regardless of patient size. Option C. Utilize standard exposure charts for average-sized patients and make minor adjustments only if the image is clearly underexposed. Option D. Increase KVP and M proportionally to the patient's estimated body mass index to ensure adequate penetration and image detail. The correct answer is D. Increase KVP and M proportionally to the patient's estimated body mass index to ensure adequate penetration and image detail. Explanation. Scenario analysis. This scenario presents a common challenge in diagnostic radiology where the principle of ALARA, as low as reasonably achievable, must be balanced with the need for diagnostic image quality. The professional challenge lies in determining the optimal exposure factors when faced with a patient whose body habitus might necessitate higher doses for adequate image penetration, while simultaneously adhering to the strict regulatory requirements for radiation protection mandated by the Japanese Association of Radiological Technologists. This requires a nuanced understanding of both physics and regulatory guidelines, moving beyond simple adherence to protocols to a reasoned application of principles. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's specific characteristics and the diagnostic task. This includes considering factors such as patient size, the specific anatomical region being imaged, and the diagnostic question. Based on this, the radiographer should select exposure factors that are appropriate for the clinical indication and patient, while still aiming to minimize dose. This might involve adjusting KVP, MA, and exposure time, and potentially utilizing dose reduction technologies if available and appropriate. The justification lies in the fundamental principle of radiation protection, which emphasizes optimizing the benefit of the examination against the potential harm from radiation. The Japanese Association of Radiological Technologists guidelines, like those of similar professional bodies, promote this balanced approach, prioritizing diagnostic efficacy while ensuring dose is kept as low as reasonably achievable. This demonstrates a commitment to both patient care and regulatory compliance. Incorrect approaches analysis. One incorrect approach is to rigidly adhere to preset exposure charts without considering patient variability. This fails to account for individual differences in attenuation and can lead to either underexposure, requiring repeat scans, thus increasing overall dose, or overexposure, unnecessarily increasing patient dose without improving diagnostic quality. This violates the ALARA principle by not optimizing the exposure for the specific situation. Another incorrect approach is to prioritize image quality above all else, leading to unnecessarily high exposure factors. While diagnostic image quality is crucial, it must be achieved within the framework of radiation protection. Exceeding the minimum necessary dose, even if it produces a technically superior image, is a regulatory and ethical failure as it contravenes the ALARA principle and exposes the patient to a higher risk than is justified. A third incorrect approach is to assume that all patients of a similar size require identical exposure factors. This overlooks the variability in tissue composition and density, which can significantly impact radiation attenuation. Failing to make individualized adjustments demonstrates a lack of critical thinking and a departure from best practice in radiation protection, potentially leading to suboptimal image quality or excessive dose. Professional reasoning. Professionals should approach this situation by first understanding the diagnostic objective. Then, they must consult relevant protocols and guidelines from the Japanese Association of Radiological Technologists. Crucially, they must then critically evaluate the patient's individual characteristics, e.g., body mass index, suspected pathology affecting attenuation, and make informed adjustments to exposure parameters. This involves a continuous learning process, staying updated on technological advancements in dose reduction, and engaging in peer discussion to refine techniques. The decision-making process is iterative. Assess, select, image, evaluate, and adjust if necessary, always with ALARA as the guiding principle. Question 15. Examination of the data shows a referral for an abdominal ultrasound on a patient presenting with nonspecific abdominal pain. During the examination, the technologist notices a potential abnormality in a vascular structure not directly within the primary area of concern for the referral. The technologist has the capability to perform Doppler ultrasound on this structure, which could provide additional diagnostic information. However, the patient has not explicitly consented to a Doppler assessment of this specific vascular area, nor has the referring physician specifically requested it. What is the most ethically and professionally appropriate course of action for the radiological technologist in this situation, adhering strictly to the regulatory framework and guidelines of the Japanese Association of Radiological Technologists? Option A. Inform the referring physician of the finding and request clarification or an amended referral before proceeding with any Doppler assessment of the vascular structure. Option B. Perform a limited Doppler assessment of the vascular structure to quickly assess its significance without further patient consultation. Option C. Document the finding but refrain from any further investigation or reporting of the vascular structure, as it falls outside the scope of the initial referral and consent. Option D. Proceed with the Doppler ultrasound of the identified vascular structure to gather all potentially relevant information, assuming it is in the patient's best interest. The correct answer is D. Proceed with the Doppler ultrasound of the identified vascular structure to gather all potentially relevant information, assuming it is in the patient's best interest. Explanation. Scenario analysis. This scenario presents an ethical dilemma for a radiological technologist involving patient privacy and the appropriate use of Doppler ultrasound technology. The challenge lies in balancing the technologist's duty to provide accurate diagnostic information with the patient's right to privacy and the potential for misuse of sensitive medical data. The technologist must navigate professional responsibilities within the strict ethical and legal framework governing medical imaging in Japan, as defined by the Japanese Association of Radiological Technologists, JART, guidelines and relevant Japanese laws. Correct approach analysis. The correct approach involves adhering strictly to established protocols for patient consent and data handling, as mandated by JART guidelines and Japanese medical ethics. This includes obtaining explicit consent for the specific examination, ensuring the Doppler ultrasound is used solely for diagnostic purposes related to the patient's condition, and maintaining the confidentiality of all acquired data. This upholds the patient's autonomy and privacy rights, aligning with the principles of medical professionalism and legal compliance in Japan. The technologist's primary responsibility is to the patient's well-being and the integrity of the diagnostic process. Incorrect approaches analysis. One incorrect approach would be to perform the Doppler ultrasound examination without fully confirming the patient's understanding and consent for the specific application of Doppler, especially if it involves assessing areas not directly related to the initial referral. This violates the principle of informed consent, a cornerstone of patient rights under Japanese medical law and JART ethical standards. It also risks overstepping professional boundaries and potentially misusing the technology. Another incorrect approach would be to share the Doppler ultrasound findings with unauthorized individuals or to use the data for purposes other than direct patient care without explicit consent. This constitutes a breach of patient confidentiality, a severe ethical and legal violation in Japan. JART guidelines and privacy laws strictly prohibit the unauthorized disclosure of patient information. A third incorrect approach would be to proceed with the examination based on assumptions or informal requests without proper documentation and authorization. This bypasses established safety and quality assurance protocols, potentially leading to misdiagnosis or inappropriate treatment. It also undermines the systematic and accountable nature of medical practice expected by JART and Japanese regulatory bodies. Professional reasoning. Professionals should employ a decision-making process that prioritizes patient rights, ethical conduct, and regulatory compliance. This involves 1. Verifying the referral and understanding the clinical indication for the examination. 2. Ensuring comprehensive patient consent, explaining the procedure, its purpose, and any potential implications. 3. Performing the examination strictly within the scope of the referral and established protocols. 4. Maintaining strict confidentiality of all patient data. 5. Consulting with supervisors or relevant authorities if any ambiguity or ethical concern arises. This systematic approach ensures that patient care is delivered responsibly and in accordance with the highest professional standards. Question 16. Performance analysis shows that a patient scheduled for a bone scan using technetium 99M MDP has expressed significant anxiety regarding the injection of the radiopharmaceutical and the subsequent waiting period, stating they would prefer not to proceed with the imaging. The technologist has confirmed the patient is mentally competent and understands the procedure is ordered to assess for potential bone metastasis. What is the most appropriate course of action for the radiological technologist? Option A. Immediately inform the patient that the scan cannot be performed due to their refusal and instruct them to reschedule with their physician. Option B. Engage in a detailed, empathetic discussion with the patient to fully explain the diagnostic purpose of the bone scan, the nature of the radiopharmaceutical injection, the expected waiting period, and the potential diagnostic information that may be missed if the scan is not performed, while respecting their final decision. Option C. Contact the referring physician immediately to report the patient's refusal and request instructions on how to proceed, without further discussion with the patient. Option D. Proceed with the injection and imaging as scheduled, assuring the patient that their anxiety is unfounded and that the procedure is necessary for their health. The correct answer is B. Engage in a detailed, empathetic discussion with the patient to fully explain the diagnostic purpose of the bone scan, the nature of the radiopharmaceutical injection, the expected waiting period, and the potential diagnostic information that may be missed if the scan is not performed, while respecting their final decision. Explanation. Scenario analysis. This scenario presents an ethical dilemma common in nuclear medicine, where the principle of patient autonomy clashes with the perceived best interest of the patient and the professional's duty of care. The challenge lies in respecting a patient's informed decision, even when that decision might lead to a suboptimal diagnostic outcome or potential harm, while also upholding professional standards and regulatory requirements for providing adequate medical imaging. The technologist must navigate the delicate balance between patient rights and professional responsibility within the framework of Japanese Association of Radiological Technologists guidelines and relevant Japanese medical ethics. Correct approach analysis. The correct approach involves a thorough and empathetic discussion with the patient, ensuring they fully understand the implications of their refusal. This aligns with the ethical principle of informed consent, a cornerstone of medical practice in Japan. The technologist must clearly explain the diagnostic purpose of the specific nuclear medicine imaging, the potential information that will be missed, and any potential consequences of not obtaining the necessary diagnostic data. This discussion should be documented, and if the patient maintains their refusal after adequate explanation, their decision must be respected. This upholds patient autonomy and adheres to the spirit of patient-centered care emphasized in professional guidelines. The technologist's role is to facilitate informed decision-making, not to coerce. Incorrect approaches analysis. Refusing to perform any part of the procedure without further consultation, even if the patient has a clear understanding and valid reasons for their refusal, can be seen as paternalistic and a failure to respect patient autonomy. While patient safety is paramount, outright refusal without attempting to understand and address the patient's concerns may violate principles of patient-centered care. Proceeding with the imaging procedure despite the patient's explicit refusal, even if the technologist believes it is for the patient's benefit, is a direct violation of patient autonomy and informed consent. This constitutes a serious ethical and potentially legal breach, as it disregards the patient's right to self-determination regarding their own medical care. This action would contravene the fundamental ethical obligations of healthcare professionals. Immediately escalating the situation to a physician without first attempting a direct, respectful, and informative conversation with the patient can be an overreaction. While physician involvement is crucial if the patient remains undecided or if there are complex medical factors, bypassing the initial communication step can undermine the technologist's role in patient education and support, and may not be the most efficient or patient-respectful first step. Professional reasoning. Professionals should first attempt to understand the patient's concerns and provide clear, understandable information about the procedure and its benefits. If the patient still refuses, the professional should document the refusal and the explanation provided. If the refusal poses a significant risk to the patient's health, or if the situation is complex, then consultation with a physician or supervisor is appropriate. The decision-making process should prioritize patient autonomy while ensuring that the patient is making an informed choice. Question 17. Operational review demonstrates that a tertiary hospital's radiology department is experiencing increased demand for advanced imaging in oncology, cardiology, and neurology. A senior radiological technologist is tasked with evaluating the current practices for contrast-enhanced CT scans in lung cancer staging, MRI protocols for acute ischemic stroke, and cardiac CT angiography for coronary artery disease assessment. The technologist must ensure that all procedures align with the most current standards and guidelines issued by the Japanese Association of Radiological Technologists, JART, to maintain optimal patient care and safety. Which of the following approaches best reflects adherence to JART regulatory framework and professional best practices in this context? Option A. Relying solely on the recommendations of equipment manufacturers for imaging protocols, without cross-referencing or independently verifying compliance with specific JART regulations for each clinical application. Option B. Implementing standardized imaging protocols for each clinical application, rigorously validated against JART guidelines, with regular quality assurance checks and ongoing education for staff on radiation safety and image optimization. Option C. Prioritizing the use of the fastest imaging sequences and highest available contrast agent volumes to expedite patient throughput and reduce scan times, assuming that advanced technology inherently ensures diagnostic quality. Option D. Allowing individual technologists to adapt imaging parameters based on their personal experience and perceived patient needs without formal protocol adherence or documented justification, to provide a more personalized approach. Correct answer is B. Implementing standardized imaging protocols for each clinical application, rigorously validated against JART guidelines, with regular quality assurance checks and ongoing education for staff on radiation safety and image optimization. Explanation. This scenario presents a professional challenge due to the critical nature of diagnostic imaging in oncology, cardiology, and neurology, where timely and accurate information directly impacts patient outcomes and treatment efficacy. The challenge lies in balancing the need for advanced imaging techniques with the imperative to adhere strictly to the guidelines and standards set forth by the Japanese Association of Radiological Technologists, JART, concerning patient safety, radiation protection, and image quality. Professionals must exercise careful judgment to ensure that all procedures are performed within the established regulatory framework, which prioritizes patient well-being and the integrity of diagnostic information. The correct approach represents best professional practice because it demonstrates a commitment to upholding the JART-established protocols and ethical responsibilities. This involves a thorough understanding of the specific imaging modalities and their applications within the mentioned clinical fields, ensuring that the chosen technique is not only clinically appropriate, but also aligns with the latest JART guidelines regarding radiation dose optimization, image acquisition parameters, and post-processing techniques. Adherence to these guidelines is paramount for ensuring patient safety, minimizing unnecessary radiation exposure, and producing diagnostic quality images that are essential for accurate diagnosis and effective treatment planning, thereby fulfilling the professional and ethical obligations as defined by the JART. An incorrect approach that prioritizes speed or convenience over established protocols would represent a significant regulatory and ethical failure. For instance, deviating from JART-recommended imaging protocols without proper justification or authorization could lead to suboptimal image quality, potentially resulting in misdiagnosis or delayed treatment. This would violate the JART mandate for maintaining high standards of diagnostic accuracy and patient care. Furthermore, failing to adhere to radiation protection guidelines, such as exceeding prescribed dose limits or neglecting necessary shielding, constitutes a direct breach of regulatory requirements and an ethical failure to protect the patient from harm. Another incorrect approach might involve the use of unvalidated or experimental imaging techniques without prior approval or rigorous assessment, which could compromise patient safety and the reliability of diagnostic findings, thereby contravening the JART emphasis on evidence-based practice and quality assurance. The professional decision-making process for similar situations should involve a systematic evaluation of the clinical need, the available imaging technologies, and the relevant JART guidelines. Professionals must first identify the specific diagnostic question and then determine the most appropriate imaging modality and protocol that addresses this question, while adhering to all safety and quality standards. This requires continuous professional development to stay abreast of evolving JART regulations and technological advancements. In cases of uncertainty, or when considering non-standard procedures, consultation with senior colleagues, radiologists, and relevant JART resources is essential to ensure that decisions are well-informed, ethically sound, and compliant with all regulatory requirements. Question 18. Analysis of image acquisition techniques for a pediatric abdominal radiograph, considering the trade-offs between minimizing radiation dose and achieving sufficient diagnostic image quality for the detection of intestinal obstruction. What approach best aligns with the Japanese Association of Radiological Technologists guidelines for responsible radiation use and diagnostic efficacy? Option A. Adjusting kilovoltage peak, kVp and milliampere-second m, as based on the child's estimated size and the specific anatomical region, prioritizing a low m as for reduced motion blur and a kVp that provides adequate contrast for soft tissues, while ensuring the signal-to-noise ratio is acceptable for diagnostic interpretation. Option B. Utilizing a standard, high-dose protocol designed for adult abdominal imaging and relying heavily on post-processing to reduce image noise and enhance contrast, assuming this will compensate for any initial suboptimal exposure. Option C. Employing the shortest possible exposure time by maximizing the milliampere (mA) setting, regardless of the impact on image noise or the need for contrast, to prevent motion artifacts. Option D. Applying a fixed, moderate kVp and m as combination that has historically yielded acceptable images for a broad range of patients, without specific adjustments for pediatric abdominal imaging or the diagnostic task. Correct answer is A. Adjusting kilovoltage peak, kVp, and milliampere-second m as based on the child's estimated size and the specific anatomical region, prioritizing a low m as for reduced motion blur and a kVp that provides adequate contrast for soft tissues, while ensuring the signal-to-noise ratio is acceptable for diagnostic interpretation. Explanation. Scenario analysis. This scenario presents a common challenge in diagnostic imaging, where the need to obtain a diagnostically adequate image must be balanced against minimizing patient radiation dose. The professional challenge lies in making an informed decision that prioritizes patient safety and diagnostic quality, adhering to the principles of ALARA, as low as reasonably achievable, while ensuring the image provides sufficient information for accurate diagnosis. This requires a deep understanding of image acquisition parameters, their impact on image quality, and the relevant regulatory guidelines set forth by the Japanese Association of Radiological Technologists, JART. Correct approach analysis. The correct approach involves a systematic evaluation of image quality indicators and patient-specific factors to optimize exposure parameters. This aligns with the JART emphasis on responsible radiation use and diagnostic efficacy. By adjusting kVp and m as based on the specific anatomical region, patient size, and the diagnostic task, the technologist can achieve the desired image contrast and spatial resolution while keeping the radiation dose to the patient as low as reasonably achievable. This proactive optimization, rather than reactive post-processing, is considered best professional practice, as it directly addresses the source of potential image degradation and unnecessary dose. Adherence to JART guidelines on dose optimization and image quality standards is paramount. Incorrect approach is analysis. One incorrect approach is to consistently use default or preset protocols without considering individual patient variations or the specific diagnostic requirements of the examination. This can lead to suboptimal image quality, requiring repeat examinations, and thus increased patient dose, or delivering an unnecessarily high radiation dose to the patient for an image that is not diagnostically superior. This failure to tailor parameters violates the principle of ALARA and the JART expectation of individualized patient care. Another incorrect approach is to prioritize image acquisition speed over image quality and dose optimization. While efficiency is important, compromising diagnostic adequacy or patient safety for the sake of expediency is professionally unacceptable. This could involve using excessively high EMA settings for short exposure times without considering the impact on image noise or the potential for motion blur, leading to a diagnostically compromised image and potentially requiring a repeat. This disregards the fundamental responsibilities outlined by JART regarding diagnostic accuracy and patient well-being. A further incorrect approach is to rely solely on post-processing techniques to correct for poor initial image acquisition. While post-processing can enhance certain aspects of an image, it cannot fundamentally improve the diagnostic information captured during the initial exposure. Over-reliance on post-processing can mask underlying issues related to inadequate exposure, leading to a false sense of diagnostic confidence and potentially overlooking subtle pathologies. Furthermore, excessive post-processing can introduce artifacts and may not fully compensate for the radiation dose already delivered. This approach fails to uphold the JART standards for achieving optimal image quality at the point of acquisition. Professional reasoning. Professionals should adopt a decision-making process that begins with a thorough understanding of the examination's diagnostic objectives and the patient's clinical context. This involves assessing patient factors such as size, age, and any contraindications. Next, the technologist should consult and, if necessary, adapt established imaging protocols, considering the interplay between KVP, MS, and other relevant parameters to achieve the desired contrast-to-noise ratio and spatial resolution. The principle of ALARA must guide every decision, ensuring that the lowest achievable dose is used to obtain a diagnostically acceptable image. Regular review of image quality and dose metrics, along with continuous professional development in imaging physics and technology, are crucial for maintaining best practices as defined by the JART. Question 19. Benchmark analysis indicates that a nuclear medicine department is experiencing an increase in the use of novel radiopharmaceuticals with varying decay characteristics and administration routes. Which of the following approaches best ensures ongoing radiation safety compliance and minimizes potential risks to patients, staff, and the public? Option A. Relying on the established safety protocols that have been in place for many years, assuming they are sufficient for all new agents. Option B. Prioritizing only patient dose reduction strategies and assuming staff and public safety are adequately covered by general hospital policies. Option C. Implementing new shielding and containment measures only when a specific incident or near miss involving a new radiopharmaceutical occurs. Option D. Conducting a comprehensive, documented risk assessment for each new radiopharmaceutical, including evaluation of handling procedures, shielding requirements, waste disposal, and emergency protocols, followed by regular review and updates. The correct answer is D. Conducting a comprehensive, documented risk assessment for each new radiopharmaceutical, including evaluation of handling procedures, shielding requirements, waste disposal, and emergency protocols, followed by regular review and updates. Explanation. Scenario analysis. This scenario is professionally challenging due to the inherent risks associated with handling radioactive materials in nuclear medicine. The primary challenge lies in balancing the diagnostic and therapeutic benefits of radiopharmaceuticals with the potential for radiation exposure to patients, staff, and the public. Ensuring compliance with stringent safety regulations, maintaining accurate record keeping, and responding effectively to unexpected events are critical aspects that require meticulous attention and informed decision-making. The potential for both acute and chronic health effects from radiation necessitates a proactive and comprehensive risk assessment approach. Correct approach analysis. The correct approach involves a systematic and documented risk assessment process that identifies potential hazards, evaluates the likelihood and severity of harm, and implements appropriate control measures. This aligns with the fundamental principles of radiation protection as mandated by Japanese regulations, which emphasize ALARA as low as reasonably achievable and the optimization of radiation doses. A thorough risk assessment allows for the proactive identification of vulnerabilities in procedures, equipment, or training, enabling the implementation of preventative strategies before incidents occur. This approach fosters a culture of safety, ensures regulatory compliance, and ultimately protects individuals and the environment from unnecessary radiation exposure. Incorrect approaches analysis. One incorrect approach is to rely solely on past experience without formal documentation or periodic review. While experience is valuable, it can lead to complacency and may not account for evolving technologies, new radiopharmaceuticals, or changes in regulatory requirements. This failure to conduct a formal, documented risk assessment can result in overlooking emerging risks or failing to adapt existing safety protocols, potentially leading to regulatory noncompliance and increased risk of exposure. Another incorrect approach is to focus only on patient safety while neglecting staff and public safety. Radiation safety regulations in Japan encompass all individuals who may be exposed to radiation. A risk assessment must consider all potential exposure pathways and populations. Neglecting the safety of staff or the public, even if unintentional, represents a significant ethical and regulatory failure, as it violates the comprehensive scope of radiation protection principles. A third incorrect approach is to implement control measures without a clear understanding of their effectiveness or without a mechanism for monitoring their performance. This can lead to a false sense of security. Effective risk management requires not only the implementation of controls, but also their regular evaluation and, if necessary, modification. Without this feedback loop, control measures may become outdated or ineffective, leaving individuals vulnerable to radiation exposure. Professional reasoning. Professionals in nuclear medicine should adopt a proactive and systematic approach to radiation safety. This involves 1. Hazard identification, continuously identifying potential sources of radiation exposure and associated risks. 2. Risk evaluation, assessing the likelihood and potential severity of harm from identified hazards. 3. Control measure implementation, developing and applying appropriate measures to minimize or eliminate risks, adhering to ALARA principles. 4. Monitoring and review, regularly evaluating the effectiveness of control measures and updating the risk assessment as needed. 5. Documentation, maintaining comprehensive records of all risk assessments, control measures, and incident reports. This structured decision-making process, grounded in regulatory requirements and ethical obligations, ensures a robust radiation safety program. Question 20. Process analysis reveals that a radiologist is preparing to administer a radiopharmaceutical for a diagnostic imaging procedure. To ensure optimal patient care and adherence to regulatory standards, which of the following represents the most critical initial step in the radiopharmaceutical administration process? Option A. Confirming the patient's clinical history, allergies, and renal/hepatic function, and verifying the diagnostic indication and suitability of the chosen radiopharmaceutical and administration route against current guidelines. Option B. Administering the radiopharmaceutical as standard dosage without confirming its appropriateness for the specific patient and imaging protocol. Option C. Administering a commonly used radiopharmaceutical without specific consideration for the unique diagnostic question or patient's current condition. Option D. Proceeding with the administration of the radiopharmaceutical as quickly as possible to minimize patient waiting time. The correct answer is A. Confirming the patient's clinical history, allergies, and renal/hepatic function, and verifying the diagnostic indication and suitability of the chosen radiopharmaceutical and administration route against current guidelines. Explanation. Scenario analysis. This scenario presents a professional challenge in ensuring patient safety and diagnostic accuracy when administering radiopharmaceuticals. The core difficulty lies in balancing the need for timely and effective diagnostic imaging with the inherent risks associated with ionizing radiation and the specific properties of radiopharmaceuticals. Radiologists and technologists must exercise meticulous judgment to select the most appropriate radiopharmaceutical and administration route, considering patient factors, diagnostic goals, and regulatory compliance. The potential for misadministration, inadequate diagnostic yield, or unnecessary radiation exposure to the patient and staff necessitates a rigorous, evidence-based approach. Correct approach analysis. The correct approach emphasizes a comprehensive, patient-centered evaluation prior to radiopharmaceutical administration. This involves a thorough review of the patient's clinical history, including allergies, renal and hepatic function, and any contraindications specific to the chosen radiopharmaceutical. It also necessitates confirming the diagnostic indication and ensuring that the selected radiopharmaceutical and administration method are aligned with established clinical guidelines and the latest evidence-based practices for the specific imaging modality. Adherence to the guidelines set forth by the Japanese Association of Radiological Technologists, JART, and relevant national regulations regarding radiation safety and the use of radioactive materials is paramount. This approach ensures optimal diagnostic outcomes while minimizing risks, reflecting best professional practice by prioritizing patient well-being and regulatory compliance. Incorrect approaches analysis. An approach that prioritizes speed of administration over thorough patient assessment is professionally unacceptable. This failure constitutes a direct violation of radiation safety principles and patient care standards, potentially leading to adverse reaction. Inaccurate diagnoses due to inappropriate radiopharmaceutical selection or unnecessary radiation exposure. Such an approach disregards the ethical obligation to act in the patient's best interest and contravenes regulatory requirements for informed consent and risk mitigation. Another incorrect approach involves administering a radiopharmaceutical without verifying its suitability for the specific diagnostic question or patient condition. This can result in suboptimal imaging, leading to inconclusive results or misdiagnosis, thereby failing to achieve the intended diagnostic purpose. It also represents a failure to adhere to best practices in nuclear medicine, which mandate the selection of the most appropriate radiotracer for the clinical scenario. This can also lead to unnecessary radiation exposure if a less effective or more hazardous agent is used. Finally, an approach that neglects to confirm the correct radiopharmaceutical dosage and administration route based on current JART guidelines and manufacturer recommendations is also professionally unacceptable. Incorrect dosing can lead to insufficient image quality or excessive radiation dose, compromising diagnostic accuracy and patient safety. This oversight directly violates established protocols for radiopharmaceutical handling and administration, which are designed to ensure both efficacy and safety. Professional reasoning. Professionals should adopt a systematic decision-making process that begins with a clear understanding of the diagnostic objective. This is followed by a comprehensive patient assessment, including a review of their medical history and any specific contraindications. Next, the selection of the most appropriate radiopharmaceutical and administration method should be guided by current clinical evidence, JART guidelines, and national regulations. Verification of dosage and administration parameters is crucial before proceeding. Finally, post-administration monitoring and documentation are essential components of responsible practice. This structured approach ensures that all relevant factors are considered, leading to safe, effective, and compliant patient care.